Namaste, I'm Dr. Rachna Shah and I'm professor in Ops and Gynae working at Kathmandu Medical College, Kathmandu, Nepal. I've been associated with postgraduate activities for last 15 years and it was my very big wish to start something to know the postgraduate students beyond their routine knowledge like doing C-sections, doing duty, doing normal knowledge of the book. And it was my very big wish to start something beyond they know and they widen their horizon by knowing nice to know this postgraduate question and answer series. So this was my very big wish and I have started. Hopefully it will help the postgraduate students and let us see. Now, today we start with the episode number 1, cesarean section on maternal request, which is an upcoming topic and people are demanding. Let us know much about on cesarean section on maternal request. So what is cesarean section by choice or request? How do we define it? Basically, it is called CDMR, cesarean section, but is a birth request by the pregnant woman without a medical reason. It is on her one choice. A pregnant lady requests to the service provider that she wants to undergo C-section. So what are the recommendations regarding cesarean delivery on maternal request? On balancing the risks and benefits associated with CDMR, the recommendations are: in the absence of maternal and fetal indication for CS, a plan for vaginal delivery is safe and appropriate and should be recommended as a norm. So any lady who comes to us for delivery requesting a cesarean delivery on maternal request, we need to make them understand that vaginal delivery still is safe and appropriate and should be practiced. But somehow, if the lady does not agree and she has to undergo a C-section, these are the recommendations. Cesarean delivery should be performed at gestational age more than 39 weeks, and it should not be motivated by unavailability of effective pain relief. Women desiring for several children should be specifically counseled before CDMR because of long-term complications of cesarean section, that is rupture uterus, scar dehiscence, placenta accreta spectrum, and peripartum hysterectomy, which increases with subsequent cesarean delivery and the risk of thromboembolism. Women's cultural, personal view and autonomy is to be respected while counseling for CDMR. What are the factors that favor CDMR? The weak quality evidence to favor CDMR regarding mother is urinary incontinence. Though one thinks that urinary incontinence is protected, but at later life, like more than 5 years, both vaginal delivery and cesarean delivery has the same risk of urinary incontinence. So it does not exactly protect from urinary incontinence, and surgical and traumatic complications following planned vaginal delivery is avoided. Fetal, it is understood that it helps in preventing fetal mortality, intracranial hemorrhage, and brachial plexus injury. Also, patient-specific factors which favor CDMR are elderly gravida, where we offer them CDMR, women desiring several children because they undergo a lot of vaginal delivery, and psychological, personality factor, interpersonal violence, traumatic delivery, depression. These patients are have difficulty in undergoing vaginal delivery or normal delivery, so they choose cesarean delivery on maternal request. Anxiety and fear of labor pain, previous cesarean delivery, pregnancy conceived by ART. So these are the other factors which favor the incidence of factors which favor cesarean delivery on maternal request. Now, cultural and societal factors to favor CDMR is cesarean delivery is established as safe alternative for vaginal breech delivery and also for vaginal birth after cesarean delivery. This contributes to societal acceptance of cesarean birth as a safe method. Now, the concept that cesarean birth is not safe is not anymore there. Most of the people, they think that cesarean section is a safe method of delivery. And another is the unpredictability of timing of onset and duration of labor is a cause of concern for many women in the society, and they would like to favor cesarean delivery on maternal request. Now, what are the risks and benefits of cesarean delivery on maternal request? Short-term risks of CDMR includes longer hospital stay when we compare to vaginal delivery, higher rates of infection, complications due to anesthesia. Risks are more in the presence of medical disorders and increased BMI. Cost definitely goes high. If performed early, may result in neonatal respiratory prematurity, hypothermia, hypoglycemia. Long-term risk includes decreased fertility because a C-section can at most go another 2 more C-sections, rupture of uterus, scar dehiscence, placenta accreta spectrum, injury to bladder, bowel, risk of blood transfusion, risk of venous thromboembolism. These are the long-term risk of going cesarean delivery. Now, what are the benefits of cesarean delivery on maternal request? That is a planned time of birth. It avoids labor. There is decreased rate of postpartum hemorrhage, lesser need of blood transfusion, few surgical complications, decreased urinary content, though it is a weak quality, reduced post-term pregnancy, reduced risk of stillbirth, reduced risk related to emergency C-section, reduced risk of non-respiratory neonatal morbidity, that is vaginal birth-related morbidity and mortality like shoulder dystocia, bone fractures, intrapartum asphyxia, transmission of infectious diseases. In spite that ladies are preferring CDMR, how do we reduce? How do we counsel them? So counseling regarding pain, fear, anxiety associated with childbirth. So basic, what are the studies done on CDMR? The pain and the fear, anxiety is the #1 cause of undergoing labor pain. So if that anxiety is released, then counseling regarding that has to be done. Prenatal classes focusing on childbirth education. So prenatal classes should be done. Availability of companion of choice during labor and provision of definitely a good pain relief. Thank you everyone for listening, for undergoing these slides, and I hope it is useful to all the postgraduate students.